Hey, so my name is Renee Dyson for the new members in our group, and welcome to New Nurse University Inc. This is a short video on how to break down nursing school exam questions. See my shirt, New Nurse University. I am the founder, and let's get started. So two things I want to talk to you about is when you are in nursing school, you have to have goals for yourself. And one of the things is I recommend thinking about NCLEX early. So a lot of times students want to wait until they know a little bit more about, nursing content and skills and things like that. But as you go along throughout nursing school, NCLEX is going to test you on the same concepts when you get to that point. So it's imperative that you study to understand and think about NCLEX now and what they expect of you so that you can have a whole 2 years or 4 years or 3 years or however long your program is to prepare versus 30 days, after graduation. Something to think about. And then the second goal that I want you guys to have is to plan to be successful. You cannot be all over the place and unorganized all the time. Use your syllabus as your roadmap, right? If you know that you have an exam coming up on safety and infection control, then that is the topic that you want to answer NCLEX style questions on to have a clue of what your nursing exam questions are going to be like, because nursing exam questions are just an extension of the NCLEX style question. That's it. And so without further ado, I want you to join me in breaking down nursing school exam questions. Now, the first one is about safety and infections control. In the group, we had a person state that they wanted to know how to study a specific topic. Well, here it is, okay? You start answering NCLEX style questions on that specific topic as soon as you can. And then once you get some nursing content under your belt from the rationales, you go back and you back it up with a comprehensive review book to elaborate more, or your fundamentals book, or your med-surg book, or whatever book that you have to give you more insight on what, that question is asking. So I'm going to read the question first, and then I'm going to read the answer choices. And then we're going to process of eliminate, because that's how you break down your answer choices specifically. So it says, when removing the mask after an aseptic procedure, what should the nurse do first? So our topic here is aseptic procedure, okay? Aseptic procedure, that's our topic. This phrase lets us know that we are removing PPE. So if you don't know the expected outcome of removing PPE, that is something that you want to look up, okay? And our question is specifically asking us, what should we do first? That's a priority action. Your life depends on it, okay? Remove the gloves, untie top strings of mask, untie bottom strings of mask, untie top strings, and let mask hang. I personally do not recommend going in and just trying to pick the correct answer first. You have to eliminate the things that do not make sense to you based on your topic, even if you don't know the topic, based on your keywords, right? In your question, it's specifically what they're asking you to do. So they're asking us to do something first. I'm going to eliminate everything that does not make sense to do first. Untie the top strings and let the mask hang. I'm not untying anything with contaminated hands if I have not removed my gloves first, right? It tells you here after a procedure. So if you have finished your aseptic procedure and your gloves have been contaminated, I'm not touching anything by my face with contaminated gloves. That's just, it doesn't make sense. So I'm going to eliminate everything that has to do with untying before I remove my gloves. Does that make sense? You're only left with remove gloves. And that makes sense. When removing the mask after an aseptic procedure, what should the nurse do first? Remove the gloves. That makes sense to me. I'm not going to untie anything with contaminated hands. I feel confident in my answer choice. Period. No second guessing. You need to keep things simple. Okay? Moving on to the next question. A patient requires a sterile dressing change for a mid-abdominal surgical incision. An appropriate intervention for the nurse to implement in maintaining sterile asepsis is to put on sterile gloves before opening sterile packages, discard items that may have been in contact with the area below waist level, place the povidone iodine bottle well within the sterile field, place sterile items on the very edge of the sterile drape. I'm going to go back to my statement or question, and I want to look for keywords, clues, and phrases, and I want to look for my topic. Sometimes you may get nursing instructors that say stem of the question. It means the same thing. Topic of the question, the stem, okay? We're doing a sterile dressing change, period. That's our topic, sterile dressing change. Now we have a phrase that says we're looking for an appropriate intervention. So I'm going to go in and I'm going to eliminate everything that's not an appropriate intervention to maintaining sterile asepsis. You have to break down your question. You have to look for keywords that will help you, that are related to your answer choices. Okay? A student said in the group that they couldn't relate all aspects of the question to the answer choices. This is how you do it. Go in, find your topic, find what they're asking you to do in your question. An appropriate intervention for the nurse to implement in maintaining sterile asepsis. That is what we are going to do in our answer choice. Now, which answer choice makes sense? Let's see. Put sterile gloves on before opening sterile packages. If you stop and think about that for a second, think about what that looks like. I'm going to put on sterile gloves to help me maintain sterile asepsis before opening sterile packages. The outside of the package has been laying in a cart somewhere or on a shelf somewhere, right? Wherever you grab that package from, is it sterile? So outside the packages are not sterile. That doesn't make sense to me. Why would I put on sterile gloves to open an outside, to open a sterile package where the contents in the inside are sterile? I'm going to eliminate this. It doesn't make sense to me. Discard items that have been in contact with the area below waist level. If you know anything about surgical sterile technique, sterile asepsis, if you know anything about sterile asepsis, you know to discard the items. Anything below waist level is contaminated, right? So I'm going to keep this one, just in case. Place the povidone iodine bottle well within the sterile field. Again, the bottle of the iodine is not sterile. So why would I place that within the sterile field? I'm going to eliminate that because it just doesn't make sense to do that. It's not an appropriate intervention. Place sterile items on the very edge of the sterile drape. Once again, that doesn't make sense to me. Okay? The very edge of the sterile drape, if you don't know anything else, it's not sterile. I know they say it's a sterile drape, but it's not sterile. This is when you should be using your content knowledge and using your test taking techniques to break down your questions. Now, if you didn't know the very edge of the sterile drape wasn't sterile, you could possibly get this wrong, but then you learn from what you just got wrong, right? You will never forget that the very edge of the sterile drape is not sterile. Okay, so I'm going to eliminate this. I've eliminated everything but B, right? So discard items that may have been in contact with the area below waist level. So B is the correct answer. Okay? I will give you rationales in a minute. Let me just get through all of these. All right, next question. So we had a question in, we had a statement in a group, and someone said that they know about the info, but they could not choose the correct answer. And so we're going to address this. The patient is placed on a clear liquid diet after surgery. Which of the following foods may the patient select? Coffee with milk and sugar, gelatin popsicles, apple juice, water, orange juice, Jello, black coffee, popsicles, ice cream. Once again, find your topic, STEM, whatever you want to call it. Clear liquid diet after surgery. Clear liquid diet after surgery is our topic. What are they asking us to do? Select foods, right, that are clear liquid diet, that's appropriate for the clear liquid diet, okay? Coffee with milk and sugar. Now, if your content knowledge, when you answer these types of diet questions, should tell you the expected outcome is clear liquid. You want it to be clear at room temperature, right? So coffee with milk and sugar. Milk is not clear, right? So just because that one part is in here, I'm going to eliminate the whole answer choice. Gelatin, popsicles, and apple juice. Okay, we want things that are clear liquid after surgery, right? This person has had surgery. They just need to be on clear liquid diet. What foods can we give our patient? So gelatin, popsicles, and apple juice. Okay, at room temperature, if they become room temperature, even if the popsicle melts, you can still see through the popsicle, right? Apple juice is clear, gelatin is clear, we can see straight through it. I'm going to keep this answer choice. It makes sense. Water, orange juice, and Jello. Water is clear, Jello is clear, but orange juice is not clear. It doesn't make sense to give them orange juice. And because this one word is in this whole answer choice, we're going to eliminate it. Once again, black coffee is clear, right? With nothing added to it. Popsicles is clear. Ice cream is not clear. If it melts on the counter, you can't see through it. Doesn't make sense. So we're going to eliminate it. Yes, I know this is an easy question, but I'm just showing you how to relate keywords to your answer choices, right? You go in, eliminate, and then now we have the only one left. The correct answer is B, because they're all clear and the patient can have all of them. Okay. Next question. This one is going to be a little bit harder. And sometimes students have problems with the topic and they don't know the topic. But here's how you can answer questions and get it correct based on not knowing the topic. Or not knowing about the topic. A child is admitted to the hospital with an acute asthma exacerbation. Which assessment finding does the nurse identify as most concerning? The use of accessory muscles when breathing, bilateral nasal flaring when breathing, audible inspiratory and expiratory wheeze on auscultation, diminished breath sounds bilaterally on auscultation. Now, all of these sound concerning, right? you come in contact with questions that sound correct. All of them sound correct. But our question is asking us for the most concerned answer choice, the most concerned assessment finding, right? So once again, I'm going to go in, eliminate the things that don't make sense to me. So use of accessory muscles when breathing. Okay, I don't see any distress here, so I'm going to eliminate this one. Bilateral nasal flaring when breathing. Okay, again, nasal flaring is concerning, but I don't see any distress. Where's the distress in these two? Okay, these two just tell me that, okay, the patient is breathing harder. Audible inspiratory and expiratory wheeze on auscultation. Now I have this wheezing, okay, that is concerning. So I might keep this one. Let me see about the other answer choice though. Diminished breath sounds bilaterally on auscultation. Okay, so I'm down to the last two, right? Which one of these answer choices is the most concerning? Okay, yes, I hear wheezing, but in my other answer choice, I don't hear any wheezing. It's diminished. You don't even have to know about asthma to know that, yes, I hear wheezing, but in my other answer choice, it's diminished. The breath sound that I'm hearing is now going away. Okay? Diminished breath sound, or it's not as loud as it was before. I'm going to assess further. I'm not going to assume that the patient is better. You cannot assume that the patient is better, right? But I need to assess further. I need more information. So that's most concerning to me. The diminished breath sounds is most concerning to me. I need to find out what's going on. Is the patient better? Is the patient worse? So I want to eliminate C, because yes, it's concerning, but it's not most concerning. And that's what my question is asking me for. So therefore, I'm confident that diminished breath sounds is the most concerning assessment finding out of all of these. Did you see what I just did there? I hope that makes sense to you. The correct answer is D, diminished breath sounds bilaterally on auscultation. Okay? No adding to the question, no talking yourself out of, no, it needs to be straightforward. Stick with the facts that you have. Yes, I hear this breathing, this wheezing, but now it's diminished wheezing or breath sounds, whatever. I need to find out more information. Okay? So the last question is about metabolic imbalances. And we had a person that says, this should say select all that apply. Select all that apply. So we had a person that said, hey, I always miss one. Okay, I can never seem to just get that one answer choice. So this is where with selected apply, you have to definitely use content knowledge and test taking strategies the same. Okay, on the same question. So a client with a 5-day history of diarrhea and vomiting is diagnosed with hypovolemic shock in the emergency department. The nurse recognizes which symptoms of refractory hypovolemic shock in the client. Select all that apply. Our topic is hypovolemic shock, right? Our keyword clues and phrases tell us there's a 5-day history of vomiting and diarrhea, which indicates the expected outcome of 5 days of diarrhea and vomiting, which is your content knowledge, right? It should be kicking in. The critical thinking should be flowing. Dehydration. And if you know the stages of shock, you know the person gets dehydrated first, right? Which is the expected outcome of 5 days of diarrhea and vomiting. If it's left untreated, because it was untreated for 5 days, the person goes into hypovolemic shock, right? What do we know about hypovolemic shock. Your critical thinking should still be flowing, okay? The question is really asking us about refractory hypovolemic shock. The patient is still in shock, okay? So we need to select all that apply. Let's read all our answer choices. So let me read the whole question again, and then let me read the answer choices. A client with a 5-day history of diarrhea and vomiting is diagnosed with hypovolemic shock in the emergency department. The nurse recognizes which symptoms of refractory hypovolemic shock in the client. Select all that apply. Dusky extremities, heart rate of 45 beats per minute, respiratory rate of 10 breaths per minute, unresponsive to painful stimuli, radial pulses +2. So, if you know anything about shock, okay, I'm using my content knowledge and my test taking strategies. I'm still going to go in and eliminate, right? Eliminate the ones that don't make sense to me first. So I'm going to eliminate radial pulses +2 because in shock, you have weak thready pulses, right? The heart is not pumping the blood adequately, okay? The heart is not pumping the blood adequately. There is no blood really to pump. That's why the heart, that's why the shock, that's what happens in shock, I should say. So normal radial pulses, I'm going to eliminate that. But now I'm going to use my strategies, okay? Because these all look correct to me. But now I'm going to use my strategies to eliminate, to process of eliminate. So dusky extremities. To me, that promotes shock, right? The patient is unstable. So you can use stable versus unstable, expected versus unexpected, acute versus chronic. But me personally, I like to use promote prevent, right? And sometimes I'll interchange and use expected versus unexpected. So I'm just going to use expected. So dusky extremities are expected in hypovolemic shock and refractory hypovolemic shock. Even if you don't know what refractory means, you still know something about hypovolemic shock. So dusky extremities, if the shock is pretty bad, you're going to have dusty extremities. So that's expected. So I'm going to keep this one. Heart rate of 45 beats per minute. Well, in shock, because the heart, I know that the heart compensates. Okay, that is the expected outcome of shock. So I'm going to eliminate this one. Why? Because when the heart compensates, it becomes tachycardic. That is my content knowledge. I'm confident in that content knowledge. And now I'm going to use my strategies and eliminate it, okay? It's unexpected for the heart rate to be down when a person is in shock. So I'm going to eliminate this answer choice. Respiratory rate of 10 breaths per minute. So in shock, right, there is the expected outcome of the respirations are to be shallow. So I'm going to keep this one because shorter breaths means bradypnea, right? And it's the expected outcome of shock. So I'm going to keep this one. Unresponsive to painful stimuli. Well, in shock, I feel like this would be expected because, let's see, unresponsive to painful stimuli. So this is the one that is going to throw everybody off. Okay, it's that one that you're just not sure about, right? This is the one that I'm just not sure about because I don't know the expected outcome of painful stimuli and shock, right? So this is the one that bugs everybody the most. Okay, when in doubt, pick it. That's my strategy, I'm telling you. When in doubt, pick it. Unresponsive to painful stimuli. That sounds like something that would be related to shock. So I'm going to keep it. And we already eliminated radio pulses. So dusky extremities were kept, so that's A. Respiratory rate of 10 we kept because that's bradypnea. Expected outcome of the respiratory rate is going to be shallow. So shallow breathing means slower. So I'm going to keep that one. And then we're going to keep this one because it is the one that we're not sure of. And when in doubt, just pick it. I know you guys are like, what? That's stupid. Hey, let's see. No, the correct answers is A, C, and D. Okay, and here are your rationale. Let me give you the rationale for this one because I know you're like, this is not right. Dusky extremities. The refractory stage of hypovolemic shock involves the organs of the system body shutting down as the client's ability to compensate for shock is exhausted. The nurse notes dusky extremities in this stage of hypovolemic shock. Heart rate of 45 beats per minute. Heart rate in the refractory stage of the shock remains tachycardic until the client decompensates further and dies, or until hypervolemic shock is corrected. Okay? The nurse may or may not be able to feel a weak, thready pulse in the extremities during this stage of hypervolemic shock. A respiratory rate of 10. Increased respiratory rate is a sign of dehydration and the initial stages of hypovolemic shock as the body attempts to perfuse vital organs, increasing oxygenation. As the client enters the refractory stage of hypovolemic shock, respirations become slow and shallow. Now, unresponsive to painful stimuli, the client becomes more comatose or severely obtunded in the refractory stage of hypovolemic shock due to the body's inability to oxygenate the vital organs. Okay, so that's your reason why D was correct. Now, the method in which we picked it was a little iffy, but just try it. Try it and come back and tell me your experience with it. When in doubt, just pick it, right? If you're always missing one answer choice to your select all apply, when in doubt, just pick it and tell me what happens. Now, don't go doing it on a test. I'm saying doing it when you're doing your NCLEX style questions or when you're preparing for your exams, right? With NCLEX style questions. Try it and see what happens. If it doesn't work, come back to me and let me know. And then the radio pulses, the nurse may or may not be able to feel a weak thready pulse with hypovolemic shock. These are the rest of the rationales. I'm not going to read them. I don't want them to be too long. If you want the rest of the rationales, the link for our email list will be available. And you can definitely sign up and get these questions with the rationales so you can practice them. And, one more announcement. So in 3 days, this live is going to be moved, deleted from our group and moved to our holiday bundle deal membership for the nursing students that are going to enroll once it opens up. So on Monday, our holiday bundle deal opens and you can start enrolling. This video will be a part of it, and then we'll have 10, it's a 10 video series. So I hope that you learned something today. I hope that this was helpful. Please get in on our holiday bundle deal membership. And I will see you on the next slide.